Someone that's just been diagnosed with diabetes has a practical side that they have to learn. They have to learn about insulin, they have to learn about carbohydrates, they have to learn about diet, exercise, hypoglycemias. So those are the very practical side of it.
Follow your instructions from your doctor and see what he advises you, or from your dietitian, because everybody is different. You can't follow the same pattern as I am following it. Obviously my diabetes is different to someone else's diabetes because they might be on a different set of tablets.
There's also the emotional side that people have to learn to deal with as well, which is you have a long-term condition that's not going away. Certain bits of your life are now out of control. You know, if you have a hypo, you can't always control those situations occurring. So that's a very hard thing to come to terms with. So the emotional side of it is very difficult.
When a parent learns that their child is diagnosed with diabetes, I think it's very important for them to try not to allow their natural panic and anxiety to show to the child. Because no matter how frightened you are as an adult, you can bet your child, you know, that fright is magnified a lot more.
How the family deal with it is also very difficult. You know, I know me, diabetes is my condition. It doesn't belong to anybody else. And I will cheat and I will do things I shouldn't do. But then you're expecting those people closest to you to pick up the pieces afterwards, which I know isn't fair, but I need to have a life of my own as well. So you become very reliant on other people, which again is a hard thing. You know, if you do something wrong, you know you've got to rely and put on somebody else that they have to pick up the pieces. That's difficult.
It's important as a parent to learn as much as you can, because you are the first point of call in your child's life. The more you know, the more you can help your child. And the other thing is to allow your child to learn for themselves and even maybe make some mistakes. Obviously, you're not going to allow them to do anything that's potentially dangerous or hazardous to themselves, but, you know, maybe ask them what they think they ought to do and enable them to make the choices, because I think it's important that they realise that they can have an impact on how they manage their diabetes, rather than the diabetes impacting on them. But it's trial and error, and sometimes as a parent you get things wrong, and you know, usually your children are the first to tell you, you know, Mum, don't fuss so much, you know, this is too much, you know, step back a while. And although sometimes you think, but I don't think you're ready for it, you've actually got to give them the chance and allow them to do that. And I don't think it matters what age your child is, whether they're 8, 10, 18, 28, 38. I think as a parent you always worry about your children. I think that's quite natural.
Diabetes isn't a condition that just affects the one individual person, it affects everybody around you, your friends, your family. You know, I am a normal person, but it's not normal. It's the thing that's not normal, not me. I'm perfectly normal, but the diabetes itself is abnormal. It's a very demanding disease, it's a very needy disease, but it doesn't make the person that it belongs to that person. That person is that person, not what the diabetes is. And you need to come first, not the diabetes.
I think for friends and family, they mostly take their lead from the person who has diabetes and those who are, you know, immediately affected, i.e. like the parents. So if your child and you have an open view of how you're acting and how you're behaving, your friends and family will follow that lead. And the way that they can encourage and help is by treating you as a normal person, not as a sick person, and not as someone who needs to be prevented from doing things. The worst thing is people who say, oh, well, you've got diabetes, that means you can't do this and you can't do that. Often people are well-intentioned when they say those things, but all it does is annoy and upset